declared a state of emergency in order to enhance our ability to proactively and efficiently respond to the threat of coronavirus. We have been focused on the inevitability that coronavirus cases would be reported in our state since the governor convened the Coronavirus Task Force on February 3rd. We have put sound protocols in place across all levels of government and through our partnerships with both our healthcare systems and our federal partners. We have been in front of this throughout the weeks of preparations, and as the governor said yesterday, the emergency declaration means that we will stay ahead of this. Our residents play a big role in our response and mitigation efforts, and we encourage them to continue doing their part. We're going to get through this together in New Jersey. I would note that through the governor's emergency declaration, the administration has taken action to waive any consumer cost shares for screening, testing, and testing-related services, including emergency room, urgent care, and office visits for as many residents as possible. We are also urging all private insurers to do the same for their policyholders. The governor's order also ensures our strongest possible protections against price gouging. And we have empowered the Civil Service Commission to implement flexible staffing policies to proactively protect our workforce, and we encourage private employers to do the same. That said, I am now going to turn things over to Commissioner Persicelli.
Thank you, Lieutenant Governor. As the Lieutenant Governor shared, we have our first mortality as a result of COVID-19. Our thoughts and prayers certainly are with the family. I will give you a short case history. It's a 69-year-old male with a history of diabetes, hypertension, atrial fibrillation, GI bleeding, and emphysema. No history of travel outside of the United States. There is a history of traveling back and forth to New York. He presented a week ago with fever and cough to his primary care physician, was treated with antibiotics and Tamiflu. He did not improve and was admitted to Hackensack University Medical Center on March 6th. History was taken and specimens were sent to the state lab on March 7th. All isolation precautions were taken. He was placed in a step-down unit. His condition started to deteriorate last evening. He suffered a cardiac arrest, was successfully revived, but suffered another arrest this morning and expired. The family has been notified. We are reporting, including this case, 4 new presumptive positive cases from the state public health and environmental labs. We do not have any reporting today from the commercial labs. That takes our total number of presumptive positive cases now in New Jersey up to 15. The cases that I just received, 2 were from Bergen. One is the individual who is deceased, and 2 are from Burlington. At this point, I do not have full case histories on either of these cases. We currently have 31 persons under investigation remaining to be tested. Just as a reminder, persons under investigation include any hospitalized person who has signs and symptoms consistent with COVID-19 and no other known diagnosis for an established diagnosis of pneumonia. Symptomatic travelers from affected geographic areas, and symptomatic individuals who have had close contact with a known COVID-19 patient. As I said yesterday, the fact that we are continuing to see additional cases is concerning. but it's certainly not unexpected. It follows the trend we're seeing around the country. We've just come from a meeting of the Coronavirus Task Force, where members of the Cabinet and I discussed the state's coordinated response to address this novel coronavirus outbreak, and Governor Murphy's declaration yesterday of a state of emergency and a public health emergency to ramp up New Jersey's efforts to contain the spread of COVID-19. Executive Order Number 103 declares a state of emergency and public health emergency across all 21 counties, allowing state agencies and departments to utilize state resources to assist affected communities responding to and/or recovering from COVID-19 cases. As the Lieutenant Governor said, the state is committed to deploying every available resource across all levels of government to help in this response. The declaration tasks the State Director of Emergency Management and Superintendent of the New Jersey State Police, Colonel Patrick Callahan, in conjunction with me, to oversee the implementation of the State Emergency Operations Plan and to direct our response. It triggers other executive powers and safeguards, such as prohibiting excessive price increases and the ability to waive certain procurement procedures. Governor Murphy's emergency declaration also empowers all state agencies, specifically the Departments of Banking and Insurance, Health and Human Services, and the Civil Service Commission to take all appropriate steps to address the public health hazard. For example, several state agencies are acting in conjunction and in coordination with us to remove barriers such as co-pays for patients eligible for charity care assistance so that they can be tested for COVID-19. As I said yesterday, we are increasing New Jersey's COVID public health strategy to include containment steps and mitigation initiatives. Mitigation interventions are decided on a case-by-case basis. They're focused on controlling the spread of disease. They can include things like self-quarantine and social distancing. They may also include things like workplace accommodations, school closures and dismissals, daycare center closures, screening and/or restricting visitors to facilities caring specifically for vulnerable populations. As I said yesterday, we are sending out precautions to the public on what they should consider if they were ever quarantined for 14 days. The department and other public health officials are available to discuss all of these situations on a case-by-case basis. Local health departments across the state are also a very important resource to help guide communities on mitigation steps. All municipalities by statute are required to have health officers, and we currently have about 100 local and county health departments. Many of them have shared service agreements with other municipalities. Therefore, a health officer who may be covering one municipality may in fact be covering two. These health officers can help inform decision-making at the local level. They are also responsible for contact tracing, which is such an important part of a public health review. Our 24/7 hotline, operated by New Jersey Poison Information and Education System, continues to take calls from the public. The hotline, as you know, is staffed with trained healthcare professionals and available in multiple languages. To date, they've answered more than 3,200 calls, over 600 just last evening. The call center can be reached at 1-800-222-1222, and if your cell phone is a non-New Jersey area code and you're calling from out of state, use the line 1-800-962-1253. We know there can be some delays for the callers, but the call center does provide important public information. The top 3 questions that we're getting is, where can people get tested? What are the symptoms of COVID-19? And information about what it means to self-isolate, meaning the person is sick or has symptoms, but is not sick enough to go to the hospital. We hope the information we continue to share, along with the public call line, will help keep residents informed. Thank you.
And with that, we'll open up for Q&A. Yes.
Commissioner, there's been a lot of talk from you and others about being self-quarantined and people who come in contact with people who are presumptive positive. Could we get some clarification on specifically what constitutes coming in contact? Does that mean you're next to somebody, they cough or sneeze in your face, they kiss you, you're 10 feet away from them? Do we know how contagious this novel coronavirus is? Does it vary from person to person?
As I stated yesterday, we talked about the transmissibility and how virulent the virus is, and that's certainly still under investigation. When we talk about having contact with a positive COVID-19, and you talk about social distancing, we usually use as a general definition 6 feet. If you're outside of a 6 feet perimeter, you should be okay. If you're closer to that, you should be concerned. And of course, sneezing, coughing, sniffling, if you're near someone that seems sick, I would move.
Okay, we'll get back to you.
New Jersey Transit about 90 minutes ago announced that it was putting on extra train service to the New York City St. Patrick's Day parade. Is a parade something that you would advise people to attend, and if so, is mass transit really the way to go?
We've had several questions about St. Patrick's Day parades. There's no recommendation to cancel your St. Patrick's Day parade. Our concern is more for the gatherings before the parade, and certainly gatherings and parties after the parade. And we feel very strongly that people that are frail, not feeling well, immunosuppressed, vulnerable in any way, should not go.
Would you take mass transit to a parade personally?
Would I personally take mass transit? Is that the question?
Parade, yes.
To the parade? I wouldn't go. I don't go to the parade.
Charlie.
I don't go to the parade. I've never gone to the parade.
This gentleman that passed away, was he a commuter? Did he take mass transit? You said there was some kind of...
I literally got this information as I was pulling up in the car today. So it was only shared that there was a history of working in New York. Obviously, the contact tracing, which will now have to go through family members, may illuminate that, but I don't have that information.
Just one follow-on. Also, Princeton Municipality put out a press release. Are you aware of the investigation of 2 Biogen attendees at a party in Princeton who went home and they were proved to be positive?
Well, we're aware of the presumptive positive that we have that attended that conference, and we are aware that the conference is sending notifications out to people that did attend. And I did not know about the Princeton case, but that does not surprise me.
Yeah.
So does yesterday's executive order declaring the state of emergency, does that affect the 4 special school board elections?
No, it does not. And there are 4 school board elections today, rather small districts, and no, it shouldn't. But you should know that all of those polling places have been provided with a sanitizer, and poll workers have been advised to take precautions. Brenda?
Yesterday, the MTA's chairman, Pat Boyd, basically said if you can avoid the subway, do it. You're recommending that people keep 6 feet away. What does this say about riding mass transit, NJ Transit, for example? We're noticing there's not many people, not as many people on the trains anymore. Is this something that you would also recommend that people should avoid if they can drive? I mean, what should people do?
I think people have to take personal responsibility for making those decisions. The 6 feet is the is the guideline if you have been near a person that has subsequently been determined to be a COVID-19. So when you're on a subway, I don't know how you could keep 6 feet away. We do not see, we have to focus on community spread. We do not see, particularly in New Jersey right now, what we call community spread, which is person-to-person transmission without a known COVID-19 exposure. When we start seeing community spread, there is no doubt that we will be exercising more vigilance in our recommendations for closures, travel, mass transit. But in New Jersey, we're not there yet. I invite Dr. Tan to illuminate that a little bit more if you can.
As the commissioner said, it's a matter of people have to evaluate their options for transportation. So some of that will, have to be a personal decision as far as what, if they have a private conveyance versus if their only option is mass transit. And again, everybody's situation might be a little bit different, but keeping the principles in mind about the social distancing